Hi, this is Sharon Weinstein on behalf of the Global Education Development Institute, and I'm delighted to share with you a session that is near and dear to my heart, enhancing clinician well-being. What was, what is, and what's next. Let's look at the slides. My objectives for today are to discuss the impact of the pandemic on nurses' health and well-being, to describe the role of self-care in enhancing well-being, and to identify 3 factors contributing to nurse burnout. I have no conflict of interest. Today is different, let's face it. Schedule changes, workloads, and acuity levels. We're living a virtual life. We have canceled meetings. We're concerned about our personal health and breakthrough infection, uncertainty, unrest, unknown, the Delta variant, and the need for self-care. Today is different. While the coronavirus has surged and the new variant is deemed even more challenging, acuity levels continue to rise. Workloads are intense and we are living that virtual life. You recall the movie A Beautiful Life. Well, there is no doubt that this is our version, a virtual life, and one in which we experienced so much disruption. Let's look at the numbers. Clinicians of all kinds across all specialties and care settings across all borders are experiencing alarming rates of burnout. Among the most telling of statistics, 35 to 54% of nurses and physicians, as well as medical students and learners, experienced substantial symptoms of burnout. Burnout is a syndrome that is characterized by a high degree of emotional exhaustion and depersonalization, a low sense of personal accomplishment at work. Clinician burnout can have serious, wide-ranging consequences on individual clinicians, on the healthcare organization, and certainly on patient outcomes. Let's look at what was. It is crucial to begin by looking at what was and what is the impact of clinician health and well-being on patient care and outcomes. Concurrently, we must recognize our need for an emotionally and physically healthy caregiver workforce. Caregivers have always needed care, and they always will. Nurse clinicians need physical and emotional support. This has been a challenge for us while staffing issues continue to escalate. In the past, we focused on workforce with ambitious plans for improvement, staffing ratio. In the past, we focused on workforce with ambitious plans for improvement, staffing ratios, and acuity levels. What is? At present, we employ preventative measures to keep staff well at work, ensuring the continuous supply of protective personal equipment and staffing levels. We find that it is more than supplies and equipment. Today's schedules can create emotional distress simply from the inability to obtain days off, from rotating shifts, and the impact of the current pandemic. Nurses put their physical and mental health on the line to protect us every day in every way. This has affected nurses' callouts and intention to leave the profession. We are in a crisis. So what's next? For a sustainable, healthy workforce, we must be proactive, promoting staff well-being, addressing the work-related causes of physical and emotional health problems, and offering support to those who are struggling. Well-being is more than a trend. Caregivers need care too. The importance of caregivers need care too. The importance of clinician well-being cannot be overlooked. A mix of the right workforce with the right skills in the right place at the right time is central to achieving good patient outcomes. We appreciate the past, we recognize the present, and we must anticipate a healthy future for nurses to truly be drivers of change. When we invest in clinician well-being, everyone wins. Recognizing that we can have this devastating consequence for the individual, the patient, and the organization. Recognizing this can have devastating experiences for the individual. An investment in clinician well-being is an investment in results. So let's raise visibility, improve baseline understanding, advance the evidence base, and follow the 5 ways to well-being activities. Connect, be active, take notice, keep learning, and give. Give of yourself. With a focus on mental and emotional health, there's a misconception that we all have to be serious in the work environment and that perhaps it's unprofessional to laugh or to have fun. Research has proven that the most productive people are those who take their job seriously and take themselves lightly. Think about your inner child. Our inner child is our sense of stability during these times of change and uncertainty. Our inner child is our sense of stability during these times of change and uncertainty. Allowing people to let their hair down, so to speak, not only results in a healthier workplace, but creates positive working relationships that benefit everyone. Remember, work smarter, not harder. And remember that self-care is not selfish. New has become next and now. The main risk factors that increase nurses' burnout were the following: younger age, decreased social support. The main factors that increased nurse burnout were the following: younger age, decreased social support, low family and colleague readiness to cope with COVID-19 outbreaks, and more. Perhaps for you, it was consistent or lack of availability of PPE. Perhaps it was not having an employee assistance program or not knowing how to use it. And perhaps it was running the vaccine program itself. What we know is that we have witnessed repeated death, post-traumatic stress disorder, and intense burnout. What are your 3 factors? What about you? Your participation in the ICN indicates your interest in learning more and making sure that you are well. I'm encouraging you to take your own temp. What are your thoughts? What's your energy level? What's your mood? And what's your perspective as you enter each encounter? What we recognize is that clinician well-being was, is, and always will be important. The impact on patient care and outcomes requires healthcare leaders to assess and address obstacles to improve clinician well-being, including that important focus on self-care. And remember what I said earlier, when we invest in clinician well-being, everyone wins. Are you ready for a win? I certainly am. Thanks for being with me today. Again, thanks for joining me today. I wish you a great conference.